Hey guys, it's Betty again. So today I want to talk about my brain surgery, how I am recovering, what I felt during the recovery period, and how it was in general. So if you're interested, please keep watching. So first I want to kind of go over what kind of tumor I had. I have a full video about my tumor story, my brain tumor story. So if you're interested in that, I will link it in the description box so you can watch that. But basically, in short, I had a pituitary tumor. So I had a tumor on my pituitary gland. It was 3 centimeters. That's a little over an inch, and it was putting a lot of pressure on my optic nerve. So I went to my neurologist, and my option was only surgery. So they were not able to shrink this tumor with medication. So I only had surgery as an option. So I had to do it because it was really big, and it was just gonna cause so many issues. Like I was gonna start losing my peripheral vision and all that stuff, so I didn't want to do that. So I did, my neurosurgeon did go over the risks of the surgery. Of course, you're having brain surgery, so there are a lot of risks involved. Some of the risks were I could have a stroke, I could have internal bleeding, which would be really hard to stop because they were going through my nose to do the surgery, which I will talk about in a minute. And I could lose my vision and all that stuff because there's a lot of really sensitive nerves in that area, so they had to be very careful, and they kind of laid out all the risks to me, so I am aware. So the surgery that I had was called endoscopic transsphenoidal surgery. So they went through my nose, and they basically dissected the tumor out. So my team of surgeons were, I had an ENT in the room during the surgery, and I had my neurosurgeon. So the first part of the surgery was the ENT basically making like kind of a pathway for the neurosurgeon to go in and take out the tumor. So he went in and kind of like opened up all of this area and exposed, shaved some bone, then exposed the area where the pituitary gland is and where the tumor was. And then my particular case, my tumor was very dense and very sticky, and it had formed a cyst, fluid cyst within itself. So my neurosurgeon said it was a very difficult tumor. It wasn't cooperating. My surgery was supposed to be 3 hours, but it lasted 7 hours because they just had to take their time because it was sticking to a lot of important nerves, and they wanted to make sure that there were no complications. So he dissected. He had to cut small pieces and then take it out, and I'm talking about they went through my nose, and my nostrils are not big, so they're working with very small tools, so that's why it basically took a long time. But it's really cool how the technology now we're able to do that. I'm just amazed. But anyways, that's another story. It was hard waking up because my body, this is kind of like my first surgery, so it was my body was having a very hard time waking up from the anesthesia. I remember they took me to the recovery room, and the nurse was trying to wake me up because they wanted my family to come in and see me, but I was like, no, I'm not ready, because I was kind of going, falling asleep and waking up, and it was just I was very uncomfortable. I didn't have pain. The only pain I had was my throat because they put an oxygen tube down my throat, and I think when they took it out, something got scratched, and it wasn't pleasant. That was the most discomfort I felt right after, right when I woke up. So that was a little uncomfortable. My throat was hurting, and I had a lot of mucus, but but it's kind of like falling asleep, waking up, like not really there. And then they had like a little like thing to cover my nose from all for drainage, because I had a lot of drainage after the surgery. So they had that on me, so that wasn't like bad, but I was just kind of like very swollen. I was like, my head was like that big. It was very, very swollen. So I was taking ibuprofen, Tylenol, and antibiotics, and I was in the intensive care. There wasn't a lot of pain involved after the surgery. The first day, like after my surgery, I didn't eat anything. I couldn't really eat because I had like, my nose was stuffy, like it was kind of blocked off, and I couldn't really open my mouth very well. Like everything was very numb on my face, so I couldn't really eat anything. But the next morning I did eat like a little bit of crackers. They gave me some peanut butter, but there wasn't any like diet restriction, so they just said eat whatever you can. So I started eating, and then the next morning I was kind of walking around in the hospital, just every like couple of hours I was getting up, walking around. Like I didn't I was like feeling tired, but I didn't feel weak. I felt kind of strong, but I didn't push it. So if I got tired, I went back to my room and I sat on my bed. So that's what they told me, not to push myself, just do whatever it feels comfortable. And if I need a break, I should take it. Because so after 2 days in the intensive care, they let me go. I didn't have my surgery on a Monday. So the first week was kind of like, I was just tired. I would lay around. I wouldn't do much. If I would like walk around, but then come back and like lay and just like eat something. They didn't really have a lot of appetite. Fine, like my doctor said, like you're gonna be tired like for a long time, for 6 to 7 weeks, he said. So just take your time. Just don't expect that that's going to happen. It's not like there's nothing wrong. You're just gonna be tired. So I kind of knew that. So I was just like taking it easy. And I did take off work for a month. So I was home for a month. So I had my surgery about 6 weeks ago. And till this day, I cannot smell or taste anything. So that's the one thing that I kind of lost, and not, I didn't lose it forever, but it's a kind of a side effect, and you would get it. My ENT said I would get it back in the next 6 months. So it just kind of like, it's just annoying. But if this is the worst of it, like I will take it any day. I'd rather have this than have any complications. So I just can't taste or smell anything, but I feel good. I'm back at work. Last week was my first week of work. I went back after 5 weeks of being off, and my doctor has me on a 6-hour work day, so I only go to work for 6 hours, which I understand why, because if I am stimulated too much, if I do too much, I get really exhausted. It's kind of like, it's a different type of exhaustion. You're just kind of like, I feel drained all of a sudden, and I need to just like go hide somewhere or lay down and recharge to be able to be like a functioning human again. But yeah, I mean, I feel great. I'm very fortunate that there was, everything went smoothly, and I'm kind of recovering very well. Of course, my stents are out already. They took it out the next, I think, 2 weeks after my surgery. I just had a lot of drainage in the first like 3 weeks. I had a lot of drainage, and then now it's just kind of like it's stopped. But I do the rinses. My ENT recommended I do it twice a day, so I do it in the morning and at night. I'm very fortunate that I've kind of like put that past me, and I'm just now on the road to fully recover. My doctor said that I should I should be fine in like 3 months to get back into working out and to lifting things. Right now, I should he said I should only like walk or do light stuff, no yoga, because I am not supposed to be bending. Like my head is not supposed to be lower than my heart. So I can't bend and I can't lift anything. So those are like the two restrictions that he has me on. But other than that, like I can do anything else, and I feel great. So I hope this video was helpful. If you're going through it, if you have any questions, please comment in the box below and let me know your question, and I'll be more than happy to assist to answer your question. And I want to thank you for watching, and I'll see you next time.